When you're in healthcare, you see that bad things happen to people, unfortunately, with no warning. And so as a provider, you're always kind of aware that sort of thing can happen, and you wonder when it might happen to yourself or to a loved one. I first learned of my heart condition on a typical day. We had obtained some new echocardiography machines.
They said, oh, if you have any free time, why don't you go ahead and play around with it? So I pulled it out and plugged it in and was messing around with the buttons, but it was always good to try it on someone else. So I was walking around looking for somebody who I could practice on. Dr. Donnally happened to be sitting in the doctor's reading room, and I said, hey, you got a few minutes? He came in and laid down on the bed, and I put the probe on his chest, and literally it was like immediate. He and I both knew that there was something wrong. And it took just a couple seconds for us both to process it, and then he kind of sat up and he's like, oh my gosh, did I just see what I thought I saw? And I was like, yeah, I think you did.
We saw the abnormality, we saw the aneurysm and the abnormal valve, and then I knew what that entailed because that's something I take care of. Through this whole thing, I was really fearful for my children who are young and my wife, and what sort of pain and difficulty they might have to go through if unfortunate things happen to me. But I was able to, lean on my faith in order to alleviate that fear to some degree. Through the care that I was able to receive in a quick and efficient way, I think that's a testament to the relationships that the physicians here have, being able to communicate with physicians from multiple different specialties and with multiple different expertise. And that way we can provide the best care that we can for when patients come here. I received a number of my tests here at Memorial, including an echocardiogram, CAT scan, and a heart catheterization. One of the most important parts of recovery is completing an exercise program through cardiac rehab. I'm now doing cardiac rehab here at Memorial. One of the worst parts about being sick and in a hospital is the unknown and the lack of control you have over things. But the staff and people here at Memorial were very caring, very centered on my experience and my comfort, and also that of my family throughout the whole process. My experience as a patient has affected my perspective as a doctor in a few different ways. I'd like to think that I was a compassionate and empathetic and understanding doctor before. I've noticed my ability to put myself in their shoes has improved dramatically. I've spent more time talking with my patients about some of the feelings they may be having, spending more time answering their questions, and I'm also understanding the impact that a disease or a diagnosis can have on not only the patient but their family. It's vitally important that if you're having any symptoms or not feeling well or have a family history of specific problems, that you contact your physician and seek the care that you need. My name is Mike Donnally. I'm a cardiologist at Ohio State and Memorial Health.